Disability, so the decreased conscious level in the trauma patient. So what might be the reasons of the decreased conscious level of trauma patients? So of course, cardiac arrest and no consciousness of the patient. Traumatic brain injury, very common problem among trauma patients. Respiratory failure and shock would lead to decreased level of consciousness. In all trauma patients, you should think about traumatic hypothermia, especially when they stay for a prolonged time outside in colder months of the year. And consider also non-traumatic causes of the lower level of consciousness, like hypoglycemia, seizures, stroke, hypothermia. I would concentrate on the severe head trauma due to traumatic brain injury. So what are the life-threatening symptoms of cerebral herniation syndrome? What is caused by increased intracranial pressure? So usually the patient with increased intracranial pressure with herniation syndrome would have the Glasgow Coma scale below or equal to 8. The second thing is the anisocoria, so pupil dilatation on the side of the injury due to edema close to the third cranial nerve. There might be also hemiplegia on the side opposite to the dilated pupil. And the patient with the head trauma, severe head trauma, will have breathing problems, the disorders of frequency and regularity of the breathing. And those patients with the herniation syndrome also might have the Cushing reflex. You might observe the very high blood pressure, which is compensation of the high intracranial pressure. So the organism, to maintain perfusion inside the brain, has to increase the blood pressure to get through increased intracranial pressure inside the skull. And the bradycardia is a reaction to an increased intracranial pressure. So the patient with cerebral herniation syndrome would have high blood pressure, very high blood pressure, and low heart rate. So it's symptomatic for severe head trauma with herniation syndrome. So what are the things to consider in the therapy of traumatic brain injury? So first of all, airways. You've got a patient with GCS below 8, so the airways are in danger of obstruction. So intubate on 8, so put a tube, put a laryngeal tube, put i-gel, as you can see on this picture. Be careful to not provoke yourself the increase of intracranial pressure. If you would fix the tube too tight around the neck, you can compress the jugular veins and decrease the outflow of the blood from the brain, and in that way increase the intracranial pressure. So do not do it too tightly. The second thing is the cervical collar. It also cannot be too tight on the neck, because you would also compress the jugular veins. Then the good idea is to, if the patient has the good blood pressure, is to put a patient in supine position with his upper part on the angle of like 30 degrees to make the outflow of the blood from the brain easier. When it comes to ventilation, ventilate the patient as a standard, like 8 to 10 times per minute. Keep the saturation above 90. But if you would observe the symptoms of herniation, then the good way to decrease the brain edema is hyperventilation, to decrease the level of carbon dioxide, and in that way constrict the brain arteries. How to do it? You do it By ventilation, 1 breath every 3 seconds, so 20 breaths per minute, not more. And if you've got the entitlement CO2, keep it between 30 to 35 millimeters of mercurium. And the circulation, we already talked about it. If you've got a patient with a brain injury, keep the systolic blood pressure over 110. That's the optimum, 110, 120, not less. Because with the less blood pressure, the brain would not be properly perfused. And because of hypoxia, because of hypoperfusion, the patient might have secondary brain injuries. Here you've got the monitor of one of the patients with traumatic brain injury, with the bradycardia, and maybe not such huge blood pressure, but this bradycardia is due to increased intracranial pressure. Okay, so that was for disability. What are the reasons in which situation you should run, let's say, or very in a fast way transfer the patient to the trauma center? Which patients qualify to trauma center? So according to Polish guidelines, the patient that qualifies to trauma center should have at least 2 of the below presented anatomical injuries, so or penetrating wounds to the head or torso, or blunt injuries with symptoms of damage of internal organs of the head, chest, or abdomen, plus limb amputation above the knee or elbow, or plus extensive crushing of the limb, spinal cord injury, limb fractures with vascular nerve damage, or fracture of at least 2 proximal long bones of the limbs or pelvis. So at least 2 of those anatomical injuries the patient should have to be properly, let's say, qualified to trauma center. And additionally, at the first presentation, the patient should have at least 2 physiological parameters at the lower level. So systolic blood pressure below or equal to 80, heart rate over 120, respiratory rate below 10 or over 30, GCS below 8 or equal to 8, and saturation below 90. So those are the points to let's say check when you would think of qualifying the patient to the trauma center.